everyone. I'm Gina Liberto. I am here at Dermatology and Plastic Surgery with Dr. Novo, where she and Dr. Saluja make people beautiful all over Brevard County. But we're having an event today, and it's bring a friend and BOGO. You get a facial, 2 facials for the price of 1. So we have a beautiful patient coming in, and come on, Ariane, she is going to have a facial today. I'd like to introduce to you Michelle, our esthetician.
Hi.
Michelle's going to be conducting or performing this facial. So have a seat and get comfortable.
All right. We'll let you get comfortable. What we're doing today is called the A-peel. So we're doing the A-peel today. So this is going to be great for everything from collagen stimulation to smooth out the skin. You can see where she's got a little bit of sun damage. There is a prescription that will actually help even out all of that skin tone. It's great for fine lines. It's great for even minimizing some of the pore size.
So Ariane, you do some video production yourself. I see you on camera. What are your goals with this?
Well, I'm out in the sun a lot.
Okay.
I have my own business where I teach outside fitness, and I also love to fish and everything, so I'm constantly in the sun. And I've noticed some aging or dark spots, I don't really know the correct word, that I definitely want to improve. And when I came here first, I had mentioned that I was like, oh my gosh, just thinking back when we were younger, we really didn't do much prevention for sun damage, and now I'm like, oh boy.
So you're just
I'm nervous
Mother
to
Nature.
even know what it's gonna
look
like, be like, feel like.
So what I'm doing first, this is exactly what it smells like. It's a little acetone, and what I'm going to do is I'll give you a little fan. It'll help with that scent, but it's going to ensure there's nothing to dilute the peel. I'm going to let you hold that for your comfort. Okay, there you go. One sec. There you go.
Thank you.
So I'm going to do several passes of that to make sure
I'm in a music video.
there is
I
nothing.
can't sling my hair out.
And this is generally painless, so I don't want you to be nervous.
Okay.
What's
That's
great,
what I was like, what's it gonna feel like?
no, what's great about this peel is the first pass actually has a topical lidocaine, so that's for your comfort.
Okay.
I'm rubbing, I have a firm application, and that too is going to help with this peel penetration.
Now, how often should someone have this done?
So generally, if it's
Film this as
possible
well.
to do this peel quarterly, that's fantastic. We have a couple of packages that we've put together really just for your best skin. We have a 90-day package, comes with 4 peels, so it allows you to plan for the whole year plus your skincare. So that's ideal, but for someone who needs correction, we can use that. We can use those peels 1 per month for say 3 months, see how she's doing, and then bank that last peel for mid-year.
Okay.
So each, it's all custom, so depending on her skin.
And then, of course, you have other products available to work in conjunction with these peels to improve your skin even more.
Absolutely.
Correct?
So my job would be to take care of her with this peel, like I said, either quarterly or once a month, but then her job would be to maintain at home with skincare.
Okay.
So we have several medical grade skincare, depending on her goals, depending on the issues at hand, how her skin responds. There are many different options. So that's something too that we customize, and we have Dr. Saluja, who's able to, you meet with her regularly, correct? With Dr. Saluja. So, and we have her to consult with. We of course have Dr. Novo and myself. So depending on her goals, what's best for her skin.
I have a question.
Of course.
Okay, so depending on my skin's reaction, will that tell me like what products I kind of need more of? Like if I need more of a pigment correcting serum or retinol, or just like the different levels? Does that make sense?
It makes sense. Not depending on how your skin reacts, but just by looking at your skin right now, I think everybody should be on a retinol, right? Because the retinol is going to help with that skin cell turnover. And that means your products are going to penetrate better. So what I like for you is the Obagi Nuderm system. And I like it because it's very, it's proven to minimize the pigment, to even out your skin tone, to brighten you up. So that would be ideal for you. Now, if for some reason you were unable to tolerate anything in that line, again, everything is custom. We will switch gears.
Okay.
Michelle, let me ask you a question. Is there someone who is not a good candidate for a peel like this?
Yes. So anyone who is pregnant, although we have services that we can provide for pregnancy.
Dang it, guys, I gotta go. Just kidding.
We
Not joking.
Just kidding.
if you've had
guys.
chemotherapy or radiation
Okay.
within the last year, if you're allergic to aspirin or hydroquinone or retinol.
Okay. And then there would just be a different type of peel or facial or service that you could
we have
provide
a
for them.
fantastic hydrofacial that is ideal for pregnant women. Deep cleanse
Okay.
with exfoliation after a really light, safe peel and whole facial extractions, and then we can infuse some hyaluronic, some hydrating products, and you leave just event ready.
Okay.
So this is just a little Vaseline I'm going to put on your lips to protect your lips and around your nose.
What if you didn't know if you were allergic to it?
What if you didn't know? That's a good question. So I am trained to watch your skin and your reactions to your skin.
Mm-hmm.
So then we would just immediately neutralize. So it's okay.
And what's the next step here?
Okay. So this is actually that was the cleanse and the preparation. The cleanse and the preparation. This next step is the salicylic acid, and also that topical lidocaine, which is for her comfort.
Okay.
Salicylic is going to help kind of just clear any more debris.
How are you feeling?
A lot.
You ready?
So generally I can get 1 to 2 passes of this on the skin. This peel is also safe to go right under the eye. So I'm gonna have you open your eye for me just for a quick second. Okay, and I'm gonna come over here. Perfect, now you can close. The other reason we love the A peel is there is no homework once she gets home. There is nothing that she has to do except leave this peel on for 6 hours. And then she's gonna cleanse with a gentle cleanser. And I'm gonna give her some products for home. A hydrocortisone cream and zinc for tomorrow.
Let's talk about the recovery for a second.
Okay.
What can she expect?
So what she can expect tonight, when she leaves here, she'll have a little bit of a yellow tint to her skin. She'll begin to feel a little dry and tight throughout tomorrow. Mm-hmm. Then generally the peeling will begin around the mouth because that's where we get the most movement. And she will begin to peel and slough for about 2 days. So it's important when you're peeling, when you're sloughing, not to pick at the loose skin. Mm-hmm. So I tell people a little hint that you can do in the shower. You can use a warm washcloth, wet, when your skin is very wet, and do your gentle cleanse very gently with the washcloth, and the washcloth it'll remove any excess skin. This is also something that you can do on the neck and the chest. That's an additional peel, but
yeah.
So it would be something for you to consider.
That's where I think, right? I feel like I really might need that right here on my chest.
No, I think that would be ideal. The chest and the neck peel a little bit differently. They peel, it takes a little bit longer.
Okay.
So I don't want people to think, okay, it's that same timeline. It usually is a little bit later.
I think we can show age there a lot faster because we're so concerned
Just
with our
forget to put
face
sunscreen on there.
when we use our makeup and our coverage, but we forget.
Yes.
And then a lot of that shows up.
We want to carry
in that
everything
area.
down.
Yes.
Mm-hmm. All right, I have a question again. Okay, so I've noticed like these dark spot areas along my lip, my upper lip area. Is that just another sign of aging or sun damage?
Yes,
Okay.
all of the above. So in hormones, sometimes
Okay.
pigment around the mouth can be hormonal. So when I do this peel, I'll apply a little more pressure in those areas, those pigmented areas, while I'm watching to see how your skin reacts to that.
Okay. My eyes are watering a little bit. Is that fine?
That's
Is it gonna
fine.
mess up the peel?
It's not going to mess up the peel.
Okay.
I'll watch. I'll take care of any tearing. But are you comfortable?
I'm good.
Okay. So this next pass is actually there's a lactic acid, a mandelic, a TCA. This is going to stimulate collagen. It's going to clear away the dead skin, this pass, and brighten and smooth the skin.
Gotcha.
This is generally the pass that feels a little spicier for a moment.
Oh, that one's spicy.
Little spicy.
Where's my spicy music in the background?
Right.
For
So
your spicy personality.
That's right.
and I'm just looking to see how your skin's responding before I rub vigorously, and it's responding beautifully. Nothing that would indicate you would be uncomfortable.
So again, ultimately, the goal with this peel is to regenerate the new skin, take away the dead skin,
Yes.
promote collagen
That's
production.
And by doing that, by removing the dead skin cells, by stimulating that process, all of your products are going to penetrate your skin better. She's going to have a brighter complexion. This pigment is going to dissipate. And then, of course, it's going to be her job to maintain it home with her skincare products.
Okay. So it'll make your products more effective,
Absolutely.
look great, feel great, look younger, be beautiful. Awesome.
Absolutely. You're going to have a nice, healthy glow. She's stunning to begin
Gonna
with.
live my
Right.
best life.
Yes.
There you go. For your best self.
That's right.
Okay, so I'm going to have you open your eye again. I'm going to do another pass under the eye. This is an area that, is one of our most common
Yeah,
concerns.
definitely
So we do want to stimulate
Wanna-
collagen under the eye. We want to,
work there.
yes, we want to get rid of, it's going to work on fine lines there. Okay, so how are you feeling now?
Good.
You're feeling okay? All right. Your skin looks, it's reacting beautifully. No concerns. Okay, so I'm going to let that just sit for a moment before we do the last pass. The last pass is the retinol and the hydroquinone, and the hydroquinone is the prescription that is going to help out with that pigment. The retinol is going to help slough off all of what we've done here today. So
This seems very simple. It's not much time invested, just
Correct.
15 minutes in the office, a couple of days of peeling. You can actually do 2 for the price of 1 with an event like this. And we have another one coming up October 17th. So make sure to RSVP and get your space. Choose your friend and come on in
friends,
and
yes.
and have that done. It's a Peel Plus 1 event.
And I like that, at that point, if you want to do your face and neck, it's 2 peels total. So face, neck, and chest, we can do that during this event as well.
Well, that's
We had
great.
such a
So-
great turnout for this that we had to extend to these additional days, which is fantastic.
That's awesome.
That's a great problem to have.
I agree.
I know I posted it on my Instagram yesterday, and I had a ton of people that were reaching out, and I'm like, there's a few slots left tomorrow, and a lot of them couldn't make it, but I told them about October.
October 17th.
Mm-hmm.
I love that we as women, when something is working and it's, we look good and people compliment, we want to share it. We want to tell everyone
Oh, for sure.
what we're doing so they can have it too.
So when you're peeling and you're sloughing, when people, just say, ask me about it. Tell me, ask me what I
Oh
did to
yeah,
improve
I'm
my
gonna
skin.
just go all over the place with that
Yes.
face.
I
I asked Dr. Sorry.
no, go right ahead.
I asked Dr. Saluja, I'm like, will I be done peeling for the wedding on Saturday that I have? She said yeah. So.
Yes. Generally, the peeling you'll be absolutely glowing in 1 week. And that's, for many, it's sooner. But we tell people safely, you do this a week before an event. Okay, I'm going to tilt you this way.
And you have other packages available too. I noticed you have the 90 days to your best skin.
Yes.
You have lots of things that work in conjunction with services as well as products.
That's correct. The 90-day for your best skin is it's one of the most popular plans that sets you up for the year for your skin. It really gives you that plan for the year. However, as I said, almost all of our services are custom. So we may want to do a microneedling in place of one of these peels. We also offer laser services. For some people, we'll lift the pigment and it'll reveal maybe some broken blood vessels under the skin. So we then have lasers that can help with that. We have an XLV, we have an IPL treatment. So a lot of those services can be included in your 90-day package.
And of course, besides the aesthetics, we also have Dr. Novo, who can perform plastic surgery and give you consultation on those other little things just to give you that younger appearance.
Can I want to do a little video about something that happened this weekend.
Tell us what you do too.
Okay. All right. So this weekend I had my solar reset, and Dr. Saluja and Dr. Novo were one of our sponsors. They gave all of our participants a $50 off gift card. And so when I was going around and I was talking about our sponsors, we all really were focusing on the how you feel inside, outside, and mental, obviously, health and physical health. And so it's a really big and hard thing for a lot of women, I think, and sometimes men, to admit when they've had work done, any kind of Botox, or, I mean, I am glad and happy to say that I've had a breast augmentation. I do need to be fixed a little bit. So I'm glad I know Dr. Nova now. But beauty is, I think, like how you feel about yourself. And I don't think people should be scared or nervous to talk about having any kind of treatment done, because you want to make yourself feel right. Exactly. Enhance yourself, and it makes you feel good. It makes you feel pretty. So with the Balanced Body and Soul, obviously my goal is for people to feel happy and live and want to be outside and just endure that. And then also it was awesome to have a company called Detox Energy Greens, where you're taking this and it's all natural and it's like a detox, and then you also have a little bit extra from at where we're at right now, Dr. Nova and Dr. Saluja's place. So you get it like from all angles. All right.
I'll take that from you. Isn't that, it's fantastic too that you share that, because I don't know how many times we've been able to share with our patients, through conversation just like that, things will come up. And you're right, sharing our experiences is so important. I'm gonna have you open your eye. I'm gonna come right under the eye one more time.
I think a lot of women, as long as you're doing it for yourself and it makes
Exactly.
you feel better.
Exactly.
And it doesn't have to be drastic. I mean, we don't want those
Exactly.
drastic appearances.
Exactly.
We want to be naturally beautiful ourselves, and these services enhance what you already have.
Absolutely. And Dr. Novo and Dr. Saluja both give that natural, and that's important, that natural appearance.
Very much.
So this was it. The peel's finished. Basically, what you're going to do now is I'm going to have you avoid the sun today, of course. I'm going to we're going to leave this on for 6 hours, and gentle cleanser. You can restart your skincare about a week later. So when the peeling stops, that's when you're going to start your skincare. Until then, the hydrocortisone that I'm going to give you, and the zinc, you can use gentle products, an Aveeno cleanser or something that you have at home that's gentle. No anti-aging. I wouldn't have you use any alpha hydroxy or any scrubs. Even a vitamin C would be too much right now, a vitamin C serum. So you're just going to wait, and then you can resume at that point 1 week.
Okay.
Your skincare.
So for washing my face, is it normal soap, or I only use what
So
you're giving me?
a gentle cleanser is,
Okay.
yes, a gentle cleanser, just as long as it doesn't have any exfoliants in it.
Okay.
Okay?
So we are excited to see Ariane's results in just a few days. Don't forget to RSVP for their next event, October 17th. All of the information is there on your screen. So for Ariane and Michelle, of course, Dr. Novo and Dr. Saluja here at Dermatology Plus Plastic Surgery for your best self. I am Gina Liberto.